Ministry of Public Health of Ukraine. Krok 1. Medicine. Year 2017. Number 150. During gastric resection, the patient received mixed anesthesia with tubocurarin chloride muscle relaxant. To restore spontaneous respiration, the patient received proserin. What pharmacological group does this drug belong to? A. Calcium channel blockers. B. Cholinesterase inhibitors. C. Angiotensin-converting-enzyme inhibitors. D. Muscarinic antagonists. E. Muscarinic agonists. Cholinesterase is an esterase that lyses choline-based esters, several of which serve as neurotransmitters. Proserin neostigmine inhibits cholinesterase activity by overdosage of tubocurarin muscle relaxant, used in intestinal atony, to improve neuromuscular transmission for disorders of movement coordination and muscular weakness after poliomyelitis. Proserin refers to neostigmine methyl sulfate. The answer is B. Cholinesterase inhibitors.